Hello, my name is Jones, and today we are going to look at ordering and control of drugs. This is unit 3 of our series in Introduction to Pharmacology. Okay, so we're looking at ordering and the control over drugs. Okay, so these are just welcoming remarks, previous lessons of whatever we learned, ethical and cultural aspect. Okay, the general objective of this lesson is that by the end of this lesson, you should be able to acquire the knowledge and the skills of ordering and control of drugs. The specific objective of this lesson is that at the end of the lecture or discussion, you should be able to explain the principles of administration and ordering drugs, should be able to calculate dosages, strengths of drugs, and the solutions. You should also be able to describe the ordering and storage of drugs. Should be able to mention the routes of administering drugs, administer intravenous fluids to a client, and also be able to administer controlled drugs. So, principles of administration and ordering of drugs. When we look at this, the general principles of drug administration and ordering includes. Okay, so first let's define what a principle is. A principle is a rule or a belief that govern personal behavior. Okay, this definition is from Concise Oxford English Dictionary. So in this case, when you're looking at principles of administration and ordering of drugs, okay, we are looking at a guide on how an activity should be conducted or performed in relation to administration and ordering of drugs. So in pharmacology, there are principles that should be followed as you order and administer drugs. These are principles which apply to all types of medication. It can be oral or injectable medication. Okay, the purpose of learning pharmacology is necessarily to enable you, the student health practitioner, have a factual knowledge of each drug given to the patient. The reason for using that drug, it's a general action, the common adverse reaction associated with the drug, and also the special precautions in administration, if any, and also the normal dose ranges. So that is the purpose of learning pharmacology. So you must therefore ensure that you order adequate drugs for your ward stocks and store the drugs in a lockable cupboard for easy access as well as to prevent people from pilfering. So the following are the golden rules of ordering and control of drugs. So what are these golden rules? Number one, it is important for the health practitioner to take patient considerations such as allergy, previous adverse reaction, patient's comment, and change in patient's condition into account before administering the drug. Golden rule number two, if the patient makes any statement about the drug or if there is any change in the patient, you must carefully consider these situations before the drug is given. Example of situations that require consideration before a drug is given may include one, that is A, problem that may be associated with the drug, such as nausea, dizziness, ringing ears, and difficulties in walking. Or any comment made by the patient may indicate the occurrence of an adverse reaction. So in this case, you must withhold the drug until references are consulted and the primary caregiver is contacted. The decision to withhold the drug must have a sound rationale and must be based on the knowledge of pharmacology. Then the second reason can be comment stating that the drug looks different from the one previously received, that the drug was just given by the other nurse or that the patient thought the primary care provider discontinued the drug therapy. So we are looking at if patient makes any statement about the drug, okay, or if there is any change in the patient, you must carefully consider these things. So we have talked of A, problems that may be associated with nausea, dizziness, ringing ears or difficulties in walking, okay, in case you have to withhold then the drug, or there are comments stating that the drug looks different, okay, than the one that was given previously for the same condition. Okay, so then you must discontinue. Okay, here we are looking at an instance of, let's say, you're giving paracetamol, okay, which have been drawing from your container, and it continues the let's say the standard color of that paracetamol is white, and due to reaction with air and the likes over time, because the lid to this container was not covered, you might find that the drug may change color, which may be a sign of loss of potency of the drug. So the drug should not change color. It may be a sign of some reaction. So when there are such comments, okay, from the clients, okay, you need to look at it and make a consideration. Okay, then see a change in the patient's condition. So sometimes you may be giving a drug that causes sedation, but the patient has a sleep problem. You may sedate the patient to death. So in such instances, you may need to change the drugs. So a change in one or more vital signs or the appearance of new symptoms may necessitate the change or withholding of the drug. So depending on the drug being administered and the patient's diagnosis, these changes may indicate that the drug should be withheld and the primary care provider contacted. So primary care provider here, we mean the doctor should be notified, the physician should be notified, the consultant within this should be notified. Okay, then number 3, okay, preparation of a drug. The golden rule is that when you are preparing a drug for administration, you must observe the following guidelines. You must always check the healthcare provider's written orders and verify any questions with the primary healthcare provider. So we have what we call drug charts. For each and every patient, you have to verify that the drug has been prescribed before you give. So as you are giving the drug, verify with the treatment chart that the patient was the drug was prescribed for the patient. You must prepare the drugs for administration in a quite well lit area for you to read the instructions easily, for you to read the dosages easily and not miss out any point. In a quiet room so that you are not disturbed by external factors within the environment that may bring about an error. Okay, you must always check the label of the drug 3 times. When the drug is taken from its storage, that is the first time, then the second time immediately before removing the drug from the container, and then the third time before returning the drug to its storage. So this is very important as you are preparing a drug or when you want to administer a drug. Okay, so you have to ensure that you check the label of the drug 3 times. When the drug is taken from the storage or the shelf, you have to check that the name of the drug that you want to take there is paracetamol. And immediately before removing the drug from the container, you counter check that yes, you are taking the prescribed drug. And before returning the drug to its storage, or as you return the drug to the shelf, you need to confirm that yes, these are the drugs or this is the drug that was prescribed. You must never remove a drug from an unlabeled container or from a container whose label is illegible. Okay, so there are no assumptions when you're giving drugs. So no, this looks like no, it's a P, so this drug maybe might be this and the likes. So everything should be clearly written. No assumptions. Of course, this is to avoid the errors. Okay, there are a lot of names of drugs that may have similar names. So simply making assumptions will not help. Okay, so it also goes for things like, this the tablet looks like this drug, so it must be this drug. So such is not allowed in the pharmacological practice. So you must never remove a drug from an unlabeled container. If it is not labeled in pharmacology, we are saying that has to be discarded. Okay, so it is illegible, then it has to be discarded because we will not know, okay, by assuming. So we encourage use of proper good handwriting, okay, so that others can read. But in the medical fraternity, you find that there are a lot of handwritings not something that is easy to read. Okay, so you must always wash hands immediately before and after preparing a drug for administration. Okay, so the grease on our hands may react with the drug, so it's important to wash hands. Okay, you must always wash hands immediately before and after preparing a drug for administration. Remember, the grease, the dirt may react, so you have to ensure that your hands are clean. Okay, and then the minor powder debris of one drug, if it remains on your hands and then you go on to pick other drugs like for oral tablets, you'll find that um, that powder may react with the other drug. So completely avoid using your hands to remove drugs from the container. You can use a scoop or a spoon or anything. Okay, you must not let your hands touch capsules or tablets. Okay, this is very important to avoid a contamination. And to remove an oral drug from the container, the correct number of tablets or capsule is taken into the cups of the container and from there into the medicine cup. You must always observe aseptic technique when handling syringes and needles. Okay, aseptic, avoid sepsis, so avoid infection. So you need to ensure that there is no cross infection as you take out these drugs. So be alert for drugs with similar names. Okay, there are certain drugs that have similar names to which you might think you might conclude. So you read everything. Okay, they might have the similar starts. Okay, but different ending. Okay, so and the like. So don't just presume. Read everything. Okay, then that way you'll be clear on the drug that you're taking. So some drugs have names that sound alike but are very different. So remember to always replace the caps of drug containers immediately after the drug is removed. This is to avoid air reacting with the drug. It may affect the drug. Okay, so avoid keeping the container open for some time because air within the oxygen may react with the drug and cause the drug to start disintegrating. Okay, so that is very important. Okay, so you find that we have some moisture absorbance within these containers, so that one should not be removed. Okay, return drugs requiring special storage to the storage area immediately after you have prepared the drug for administration. This is to avoid the drug from losing its potency. Remember those drugs that you keep in the fridge, okay, those that have to be kept refrigerated or whatever the case. So remember to put them in the right environment because any change in temperature may affect their power or potency. So this rule applies mainly to the refrigeration of drugs, but may also apply to drugs that must be protected from exposure to light or heat. Never clutch tablets or open capsules without first checking with the pharmacist. There are tablets that can be actually divided, and they will even have some dividing lines. Then, when you attempt to cut such drugs, you may find that eh, there are reasons as to why drugs are capsulated. There are reasons as to why those drugs that you can share in half or share in quarter, they have those lines. Others, they are too strong, okay, that you cannot even divide them. If you try to divide them, the drug part of it might be lost. Okay, so it's important you check with the pharmacist when such arises. So some tablets can be crushed or capsules can be opened and the content added to water or tube feeding when the patient cannot swallow a whole tablet or capsule. So some tablets have a special coating that delays the absorption of the drug. So find that these coats that these drugs have, and then you cut them. It means when you take the drug, it will easily be lost within the gastric acid and it will not be absorbed. So that's why you need to know that some drugs are coated. Crushing the tablets may destroy this drug's property and result in problems such as improper absorption of the drug or gastric irritation. Never give a drug that someone else has prepared. You find the drug has been prepared and they have put in the syringe, and then you assume, oh, this is it, this is that. That is dangerous. So if someone else has prepared the drug, you should not give, because it's that person who is the sure of the drug that they have drawn and put in the syringe. It's that person who knows the tablet that he has put, okay, within that saucer or anything that they are using. So the individual preparing the drug must administer the drug. Okay, you don't hand over. You don't hand over. Oh no, here I leave my tray. These are the drugs that I was giving. No, it's very difficult to assume the tablets that are there. This can bring about errors. So if you follow the above mentioned drug preparatory rules, you will never be a danger to the patient, but a lifesaver. Okay, so now the general principles for pouring and administration of medication. These principles apply to oral as well as injectable medication. Drugs should be ordered properly so that there is always an adequate supply when it is time to pour medicine. Any change in color, odor, or consistency of a medicine should be reported and a fresh supply, okay, obtained. To discard or waste a drug, throw it down a drain, in a sink or toilet, and run some water down the drain. Okay, but otherwise, if you have other proper disposal methods, it's better you use them, and like throwing them in the toilet and the sink, because these drugs are going in the toilet and sink, and they are now becoming part of the system of the water that needs to be purified. Okay, so it's better you have a good disposal system so that drugs can be the waste management of the drugs can be done at a central unit, unlike throwing them necessarily in the sink or toilet, because they enter our water system that is purified. Okay, do not throw in a rubbish bin where it could be retrieved and eaten by someone. Okay, you throw, then dogs will pick up that, and they find that the drug can fall, or then when it falls off, others can easily pick it, or even the dogs eat these drugs and they are part of the food chain. We find that they tend to have other diseases, okay, that might even affect us. So you must not return medicine into their original container after pouring them. When you have poured the drug out, you should not return it in its original container. Okay, if they will not be used, they discard them safely. Half tablets may be saved. You have to need to have a system of saving those tablets where, if at all, let's say you had cut in half, you find a system and like retaining them there. It may break down and you may not find anything as a piece that you might have left. Avoid handling medicines with fingers. Okay, this cannot be emphasized more because we know cross infection of fingers. Okay, if a medicine is dropped on the floor, discard it and pour another. Okay, you don't pick drugs from the floor, okay, ground. If they fall, they are falling on a contaminated ground, so they should not be picked to give the patient. You must never leave the medicine cupboard opened and unattended to. If you leave it open, any person can grab a drug, you might lose a drug from there, okay, or leave it unattended to, okay. So you don't want pilfering to happen. So you must never leave the medicine trolley unattended when it is set for medication rounds. Then the medicine cupboard key must always be kept by a person qualified to give medicine. If you are assigned to medicines, you must keep the medicine cupboard key at all times. It should never be left lying around. Okay? So, pouring of medication. Here we are saying never pour or give medicine in the dark or in dim light, because it will affect the way you're going to measure the requirements that are needed. So the label should be read 3 times as shown below to ensure that the correct drug and amount are given. So this applies to both oral and injectable medication. Before picking up the container from the trolley, Okay, before pouring the medicine and after pouring the medicine. So those are the three times at which you read, okay, about the drug. So never give medicine from unlabeled container. This, okay, we have also mentioned it in other part of the notes within this lesson. Okay, so never, never should give a drug from a labeled container. Can never be sure, despite knowing the shape of the drugs and the likes. That does not count. Right? Always know the drug are being given. Look it up if necessary. So when you're giving the drugs, read more about the side effects. There, you should have knowledge about the drug that you are giving. Don't give a drug you do not have knowledge about it because you won't know how to counter the side effect. This will prevent errors and it will enable health teaching to be done or to know any special precautions. So the drug that you are giving, if let's say it turns the urine color to yellow or orange, you need to explain to the patient. If at all it changes the smell of the urine, you need to explain to the patient because the patient might think the situation or the condition has become worse. So that's why you need to know more about the drug that you are giving for health education purpose. Then the other one on administration of oral medication is that the administration of oral drug is a clean procedure, an instrument used that should be surgically clean. Okay, so it should be surgically cleaned daily. You must do a quick round, noting the drugs that are supposed to be given at that particular time. This helps to avoid setting for drugs that patients are not on and also helps in avoiding omission of important drugs that are supposed to be given at that particular time. Okay, then during this survey, you must inform the patient that you are about to give drugs and find out whether any of the patient's needs assistance has been attended to before you bring the drug. This is to avoid unnecessary change in procedure as you are taking the drug. So you have to ensure that the patient is comfortable as you come to give the drug. You must always administer the drugs you pour and sign for them. Never allow a patient to carry medicine to another patient. They might start sharing these drugs and find that the patient is not recovering because maybe the patient was not taking the drug. Never give medicine that someone else has poured. Okay. Do not give oral medicine to unconscious patient because they cannot swallow. Notify the ward manager if at all there are any adverse effects of the drug so that the necessary antidote can be given. The medicine will either be discontinued or advised to be given parenterally for the unconscious patients. Then, when medicine is not given to a patient, always notify the ward manager. This may happen when a patient refuses medicine or for some other reason the medicine was not able to be given. So, if the drug is not available at that moment, you notify the ward manager, okay, so that they can take note or the appropriate drug can be ordered, okay, or you have to put up the reason as to why maybe the drug has not been given. So any mistake in giving a drug should be reported immediately to the ward manager so that the patient's life can be saved. Okay, so now for children, do not mix liquid medicine for children. You must give the sweetest drug last. Okay, so that is for children. Okay, so if you say, oh, this one is a syrup, another one is a syrup, then you just mix them so that you give them at one time for your own convenience. These drugs may react together. So you have to ensure that you do not mix these drugs. Okay, and the sweetest drug should be given last. If having difficulties giving the medicine, you can use a teaspoon after first measuring the amount in the medicine cup. Okay, so you can also allow the mother to give the medicine to the child, but you must remain with them, however, to make sure that the child has taken the medicine. You can assist or instruct the mother when necessary, and do not force children to drink medicine as they could easily aspirate or even vomit the whole drug. Okay, so now let us talk about the procedure of giving medication. Before giving medication, make sure you have Identify the right patient. Ask the patient's name politely and check the chart, especially if the patient is not competent or if you are new to the ward. So you will take a drug chart, okay, not the patient's name, you note the bed number, okay, and then go to the patient, okay, so that you verify the patient's name. Then number two, of course, there are checklists to this. So when you're doing procedure, so you have to do everything according to the checklist. Otherwise, these are very important points that you should note as you are doing the procedure. You can ensure the patient has plenty of water to drink with the medicine. For instance, let's say you can pour the water for the patient as necessary. Remain with the patient to be sure he has swallowed the medication. After you have given the patient the drug, you can talk to the patient so that you can note if the patient has swallowed the drug. Because someone with something in the mouth, okay, the speech may change. So that can help you to note that the patient is still having the drug. So you give them and see that they have swallowed the drug. Okay, so now let us now talk about charting of medication. Chart the medicines that you have just given to the patient. If not signed for, it means not given. Okay, so those are some of the things that you need to know. So if it is not signed for, it means it has not been given. It is not ticked, that means it has not been given. So you can check the patient's chart for name both on the doctor's advice sheet and on the current medication sheet. Make sure you are charting on the correct date. Chart medicine in the medication column, including the name of the drug, dose allowed, and time. Your signature is not necessary, but use your initials. Mostly the space is very small, so you might have to use your initials. Okay, now let us now talk about dosages and strength of drugs and the solutions. So we are going to talk about drugs, solutions, and the fluids. So a drug, by definition, is a mixture of substances used in the diagnosis, cure, or for and in the prevention of a disease. So when you're looking at a drug, we just look at it as a substance for diagnosis purpose, for cure purpose, or for prophylaxis of disease. So the word drug comes from a Dutch word drug, that means dry, comes from the early use of dried plants, okay, leaves as a source of medicines. So the term drugs and medicines are used interchangeably, okay, though nowadays a drug is commonly used for abuse of substances, whereas the word medicine is for therapeutics. Okay, sources of medicines. Okay, so here there are four sources of medicines that we have tried to talk about within this lesson, and that includes plants and roots. For instance, digitalis drug, they come from plants. Okay, foxglove. Okay, so plants and the roots. Then we have animal tissues, where insulin, has been derived from the spleen of pigs. So we have that. Then molds, the famous antibiotic penicillin comes from molds. Then number four, laboratory. So laboratory, you're looking at synthetic or man-made. Okay, so gantrizin is an example there. Okay, so the general purpose of drugs. Let us now look at the general purpose of drugs. So the following are the general purpose of drugs, that is for prevention or prophylaxis. The purpose of drug for prevention or prophylaxis. Then the other general purpose is for diagnosis. Okay, the general purpose is diagnosis. Then the third one is for therapeutic, which includes a curative, palliative, symptomatic, supportive, and restorative. So when you're looking at a drug and talk about the general purpose, we're saying the main use of the drug, okay, the fundamental use of the drug is for prevention, okay. So in prevention, you take a prophylaxis. For diagnostic, okay, there are some dyes that are used in order to diagnose certain problems. And then the common purpose mostly is for therapeutic. Okay, so in therapeutic, it includes a cure, curative, palliative, okay, and supportive. General purposes also here continues where when you talk about prevention of prophylaxis, what we necessarily mean. So drugs can be given to prevent the occurrence of a disease or to lessen the severity of the disease if it should occur. So some example of drugs that are given for prevention or prophylaxis here we have vaccines, okay, Daraprim. So those are some of the drugs that are given. Like let's say we talk of Fansda. Okay, so it is given for prevention of malaria as prophylaxis. So these drugs, vaccines, Daraprim, are given as prophylaxis. Okay, then the general purpose of drugs, I'm talking about diagnostic. Here, drugs can be used to aid the doctor in deciding the cause of the patient's symptoms. They are also helpful in locating the exact area of the body affected. An example I can give is in intravenous pyrography, a dye is used for this procedure. For the other general purpose is therapeutic. Drugs are used in the treatment of many diseases. Okay, so A for curative, drugs are used to remove the causative agent of the disease. Sometimes the drug is effective against only one disease. Okay, in other cases, against several. When you talk of antibiotics, they work against a lot of bacteria or germs. Okay, then in palliative or symptomatics, a drug can be used to relieve the undesirable symptoms of a disease. The disease may not be cured, but its severity is decreased and its progress also checked. Okay, so if someone is in pain, you just give analgesia. Analgesia, they reduce the pain. Then in supportive, drugs are used as to sustain the patient until other measures can be instituted, okay, which will either cure or alleviate the condition. For instance, intravenous electrolytes, especially potassium. Then restorative as one of the general purpose, okay, dosages and strength of drugs and solutions. So we're looking at restorative. Drugs are used to retain the body to its normal or healthy state. Okay, like if someone has got anemia, you give iron preparation in order to restore the hemoglobin level. But it's also important to note that medicines are only one method of therapy. Other forms of therapy include surgery, diet, nursing care, okay, then physical therapy, and the others. Okay, so now let us talk about different preparations of drugs. There are different preparations of drugs that are available and they have different names. Of course, the name also may give you a clue to what that is made from, okay, or what that contains. So when you say aqueous solution, one or more substance that has been dissolved in water. So aqueous in relation to water. So this is an aqueous solution of, then you talk about those chemicals. So one or more substances have been dissolved in water. Then aqueous suspension. Okay, when you talk of aqueous suspension, that is mixed with but not dissolved in water. Okay, so mixed with but not dissolved in water. So a suitable liquid vehicle sometimes may already be mixed. Sometimes you have to add the liquid. Must be well shaken before you. So when you shake, okay, when it's suspension, that's when it mixes. So mixed with but not dissolved, it's a suspension. Aqueous solution where one has it dissolved. Okay, so we say, oh, what that one is a suspension. So suspension, you are required to shake before you take so that all the chemical components can mix nicely. But in aqueous solution, find that the chemical component or substances have dissolved there. Okay, spirits. These are concentrated alcoholic solutions or volatile substances, also known as the essence. Okay, spirits contain about 5 to 20% of active drug, which may be solid, liquid, or gaseous. The alcohol is the preservative. Usually, these preparations are all potent, and therefore the dosage is usually very small, like 2 to 4 mils. Okay, then elixirs. These are aromatic, sweetened alcoholic preparations frequently used as flavored vehicles or as active medicinal agents. So when I'm talking of an elixir, it's an alcohol-based aromatic sweetened preparation. Alcohol-based aromatic and sweetened preparation. Okay, with a bit of flavor as a vehicle for the active medicine. Okay, then when you talk of tinctures, a tincture, this is an alcohol solution containing 10 to 20 grams of drug to 100 mils of the tincture. The alcohol content improves their stability and facilitates absorption of drugs that are poorly soluble in water. So that's why this alcohol component is being used. Fluid extracts. Alcoholic liquid extract of vegetable drugs made so that 1 ml of the extract contains 1 gram of the drug. Okay, so we're talking of fluid extracts. They are the most concentrated of any of the fluid preparation, being of 100% strength and 10 times stronger than potent tinctures. May precipitate in light and should be kept in darker bottles and not used if the precipitate has formed. Okay, you may be wondering why most syrup, drugs, and the like find that they are found in a brown bottle and the likes is because they can easily be affected by light. So that is why they are packaged in those brown bottles. Usually, these preparations are all potent and therefore the dosage is usually small. Extracts. These are concentrated preparation of a drug obtained by removing the active ingredient with its solvent and evaporated or part of the solvent. They can be liquid or pressed masses or powder. This form is used for purposes of making other forms of the drug, such as tablets or pills, or by pharmacists, they can do a compounding. Then capsules, more expensive to produce, but usually used in the beginning with new drugs until such problems as bad taste, disintegration, stability came across. Okay, so have been solved by the manufacturer in many ways, and this time would say formation of capsules is one of those cheapest. Even someone within their backyard can compound a drug in a capsule. So they dissolve readily in the stomach, and the contents are quickly available for absorption. Capsules are usually made of gelatin. Okay, the capsule material is usually made of the gelatin material. So some are enteric coated, which means that they are coated with a substance that resists action of gastric juices. And so they don't dissolve until they reach the alkaline secretion of the intestine. So they will not dissolve in the stomach. So those are the ones that are enteric coated. Okay, so they only dissolve when they reach the small intestine. Some capsules allow for gradual and continued release of the drug and are called spansules. Okay, so when you talk of spansules, they are time-released capsules. Okay, these work by way of particles of the drug are being coated with varying amounts of a covering that require different amount of time to dissolve. So as they are dissolving, then the spansules may release the drug for as long as up to 10 to 12 hours after being taken. Okay, then the other preparation that we have are tablets. Preparation of powder that drug that are compressed or molded into small discs and are without a diluent. So that is a tablet. Okay, it's a preparation of a powdered drug compressed in a disc or molded in a small disc without a diluent. These may be scored so they can be easily divided in half. depending on the doctor's advice. They may be anesthetic coated with the color, sugar, or chocolate for one of the five possible reasons that I'm going to give here. So, one of them is to make them more attractive to patients, for easier to swallow, identification or identifiable by a distinctive coloring or imprinting. Then the other reason is to protect the drug from gastric secretion. Then the other reason is to prevent irritation of the stomach from the drug. So that is the reason why some of these tablets may have different colors. Okay, they may have different colors so that they look more attractive, easier to swallow, for identity purpose, protecting them from gastric secretion and prevention of irritation to the stomach or by the stomach. Then we have troches or lozenges. These are preparations that are held in the mouth until they dissolve, liberating the drug involved. So troches or lozenges, if someone has a cough or cold, there are a lot of lozenges out there that someone can lick and get it done so that the drug can be released. Then we have pills as one of the preparations. So pills, technically speaking, pills are different from tablets or capsules, though the term is often mistaken used as a general term for these. In actuality, pills are a mixture of a drug or drugs with some cohesive agent molded into a shape convenient for swallowing. Very few true pills are, in fact, on the market today. For instance, when you talk of contraceptives for family planning, okay, so those are pills. Then powders as one of the preparation. These are finely divided as solid drugs or mixture of drugs for external or internal use. So they're so fine, fine powder, like millimil, so fine that they are like a powder. Okay. Then we have ampoules or and vials. So the containers of the sterile powdered or liquid drug, usually intended for injection. So those are drugs that are usually intended for injection are found in an ampoule or a vial. Ampoules are sealed glass containers, usually with one dose, and vials are usually glass but a rubber a stopper. That's what they have, okay, and may contain multiple doses. So in talk of ampoules, they are sealed glass container with about one dose, and then when talk of vials, they are also glass but have a rubber stopper, and the rubber stopper here means you can take more than one dose. So in top of ampoules, you just give one dose from it, you get it there, you open it. But when talking of vials, that you have a rubber stamper from which on top there you can withdraw the drug and give, and the rubber will remain there securing the drug. Okay. So ampoule, when you talk of gentamicin, diclofenac, okay, so those are ampoules. Okay. When you talk of vials, you talk of benzyl penicillin, okay, and the like. So those are found in vials because they have more than one dose. Okay, so it's important that we make this distinction when you're talking of ampoules and vials in practice. So powders must be dissolved in sterile distilled water or isotonic saline solution. Okay, when we say isotonic, we are saying same electrolyte as fluid. It is going into, that is blood, so that the isotopic pressure is the same. Okay, so the powder within the vial, okay, we put normal saline so that we can dissolve the drug. Okay, when the drug is dissolved, then it's going to have an isotonic um, uh, isotonic balance between the blood and the same drug. Okay, then on preparation, we can talk about disposable syringes or cartridges to fit in a tube holder for administration. So these are pre-packed drug to be given by injection, and then the container is discarded. Okay, then we on preparations we also have liniments. Liniments, these are liquid suspension intended for external application. Applied to the skin by rubbing, usually used for muscle pain, swollen joint, spot injury. So liniments, okay? So liniments, there are a lot of them, that are used within uh, physiotherapy treatments. So liniments are quite available. These are suspensions that are intended for external application. Then we also have lotions. When we talk about lotion preparation in pharmacology, we are looking at liquid suspensions for external use, which are applied to skin but not rubbed in. Okay, so when you're looking at a lotion, you're just looking at a liquid suspension for external use, okay, which can be applied to the skin but not rubbed. Okay, they are usually used to soothe, cool, reduce itching. Okay, so we have a lot of lotion drugs that are there. Then we have ointment preparations. So these are semi-solid preparations of drug in a base of petroleum and lanolin, intended for external use. The base is such that it doesn't wash off easily and so keeps the drug on the skin for a long time. Okay, like put Vaseline ointment there. So it will remain there on the wound, maybe where you have applied for a long time. Ophthalmic ointments are sterile and the base must be non-irritating and allow the drug to pass into the secretion of the eye. Then we have pastes. Okay, so for external use and usually thick and stiff and do not melt at a body temperature. Okay, when you talk of toothpaste, that does not melt at body temperature. So meant for external use. So we have drugs that are available in paste form. So may protect or soften skin. For instance, zinc oxide paste. Okay, so that can be applied around an ostomy. Okay, then we have plasters. These are solid preparations that are applied to the body and stick to it. Okay, aspirin may be given this way in combination with a rubber plaster that sticks to the area where it is applied, and as such, it is used as a counter irritant. Okay, the other preparation that is there are suppositories. Suppository, it's a mixture of a drug in a firm base that can be molded for insertion into a body cavity where the base melts with the body heat and the drug is released. Okay, so for suppositories, we have those for the rectum, vagina. Okay, so vaginal pessaries come in form of suppositories, or others can even be inserted within the urethra. Then we have poultices. Okay, these are soft, moist preparation used for purposes of supplying moist heat to a skin area. Okay, so now with those preparations discussed, let us now look at medical calculation in pharmacology. These medical calculations, it's important that we know the units that are being used so that if certain units have not been changed, they can be appropriately changed so that we find the correct answer. So when you talk of metrics, may refer to the metric system of measurement that uses the meter, okay, milligram, gram, kilogram, milliliter, liters as a basic unit. So the basic units in metric system, okay, we have meter, okay, that is unit of a length, liter, unit of capacity for volume, and then gram, unit of weight, area, that is unity of area for land, okay, for land measure. Okay, so prefixes used in the metric system also should be noted because mostly those are the ones that are used. So micro, okay, we are talking of 1 micronit or denotes 0.000001, okay, and then milli, okay, that is 1,000 thousandths, and it denotes those number of zeros. Okay, so these are very important when you're calculating and when you want to convert. Okay, when you want to convert a figure, well, if it is they are not in the same unit, then we have centi, that is 100. 100. So it's important for micro 1 million, milli 1000, and centi 100. Then a deci, that is 1/10. So 1/10 there, that is 0.1. Okay. Then when you say deca, that is 10, it did not see 10 there. Then when you say hecto, that is 100, did not see 100 there. Then kilo, thousands, and did not that 1,000 there. Then mega, million. So the opposite of micro there, 1 million is mega. Okay, so we have that 1 million. Opposite of million, 1,000, here there we have kilo and the like. So it's important you note these, and then the number of zeros, the way they have shifted. Okay, from micro it was 0. What, and then mega, you find that now the zeros they are in front. It's important so that you can do the conversion if at all things within your calculations are not within the same. Medication calculations also, 1 gram is equal to 1,000 milligrams. When you talk of 1 milligram is equal to 1,000 micrograms. Okay, then when we talk 1 liter is equal to 1,000 milliliter. It's also important to note that 1 liter of water is going to be it's going to be 1 kg. Okay, so that is just something to note. Anyway, all right, so medical calculations of the amount of medicine to be given to a patient, that is number of tablets. Then we have two items that we need to know. To those require that the doctor's advice, okay, so the dose required, that is for the doctor's advice. Then the amount of medicine in 1 tablet, so what you have to give. So the doctor requirement, that is one part that is going to be used, and then the amount of medicine, in 1 tablet, or what you have in stock. You get it, huh? Okay, so to amplify this one, let's say medical calculation, the formula is amount to be given for tablets is equal to doctor's order divided by the strength available. The strength available in what? In stock. What the doctor has ordered. Of course, everything we have to multiply with 1 tablet. That is it, with 1. Okay, and any number multiplied by 1 is 1. So you find that, others when they're writing the formula, they don't put the times 1. So times 1, okay, that is the 1 tablet or capsule. So what we are going to find, the amount to be given for the number of tablets, the unit will just be the number for that. So we have an example here. The doctor has prescribed 1,000 milligrams of paracetamol orally. The tablets available contain 500 milligrams of the drug. Calculate the number of tablets you are going to give this patient. So doctor's order, okay, strength required. So people might write all that. That is just for doctor's order. Okay, times 1 over strength available. So here within this question, 1,000 milligram is prescribed. Who prescribed? The doctor. You get the diet times 1 over the tablets available are 500 milligrams. So this is what you have in stock. So if you have 500 milligram in stock and you have to give 1,000, how many of these 500 are you going to give? So you give 2 tablets. Okay, so that is calculation for tablets. Okay, so the base of the formula, even for fluids, is from this, but you need to know that instead of saying times 1 tablet, you say times the volume. Okay, the volume, when we reach there, we're still going to expand. Okay, so for liquid dosage forms, so amount of to be given, that is in mils. Okay, it's doctor's order times amount of volume. Okay, so times amount of volume, that is the one that you are using there, over the strength required. Okay, here we have an example. The doctor has prescribed 75 milligram of injection of diclofenac to be given 8 hourly to the patient. What you have in stock is diclofenac injection 75 milligrams per ml. So how many ml of diclofenac injection are you going to give? So the doctor here has ordered 75 milligram. Okay, so 75 milligram times the volume. Okay, remember the volume there. 75 milligrams times volume. So volume, that is 1 ml per ml, also divided by 25. So 75 divided by 25 gives us 3 mils. Okay, in trying to check out this, we are saying 25 milligrams per meal. So each and every meal has the strength of diclofenac of 25. So how many 25 are going into 75? 3. So in 3 meals, there is 75 milligrams of diclofenac. So that's what that simply means. Please, for injectable, remember times the volume always. Okay, the volume, the one that has been used to mix. Okay, so there per meal, it's per meal 25 milligrams and the like. So it's important you note that. Okay, other things to note is that it is essential for the nurse to take note that when administering fluids and blood or its component, you can use the correct drop factor. So now this one is for fluids that we are administering drips. So for fluids, we have a standard drop factor of 15. Okay, it may be found on the giving set. Okay, then for blood, the drop factor can be 10. Or okay, so otherwise, I would say drop factor for blood mostly is 15, but otherwise you have to check on the giving set. And then for fluid, mostly the drop factor is 20. Okay, but otherwise, for the purpose of this lesson, I put fluid 15 as a drop factor, and blood may have 10 as a drop factor. Okay, but uh, this was at the time I was putting these notes together, but otherwise, what is prevailing right now is that for blood we have 15 drop factor, and for fluids we have 20 as drop factor. But the drop factor can be checked from the giving set. Okay, so for fluid dosage forms, rate of fluid flow from a drip, we say amount of fluid times drops. Okay, so that times the drop factor. Okay, divide by hours to administer. So these hours here should be times the minutes per hour. Okay, so meaning times 60. Okay, so that we convert them into minutes. Here, the doctor has prescribed 1,000 ml of normal saline to be infused to the patient in 8 hours. You have to calculate the rate of fluid flow. So the amount of fluids, okay, times the drop factor, hours to administer times minutes, okay, so that you convert them into minutes. So the doctor has ordered 1,000 times it. This is a fluid, so we will replace with 15, okay, 15 for fluid for the sake of these notes, the way we have tabulated them. So 15 for fluids there. Then 8 hours to convert it into minutes, we are going to multiply with the 60 minutes, okay. So when we do the calculation there, we find that we are going to have 31 drops per minute. Here we have to round off we have to round off, and it should not be in decimal because we cannot count a drop as a decimal. So we round off, and that is the answer that you're going to find, 31 drops. So make sure the drug ordered and the amount to be given must be in the same measurement. Okay, if they are not in the same measurement, you're not going to find the correct answer. Both in grams or both in milligrams. If they are not in the same units, then you must convert one in the other units. So you make two equations and cross multiply, one using the number of tablets required, and this will contain the exponent. The second using the bottle label, what you have per tablet. Of course, all the other, apart from knowing the formula, you need to know that all the other mathematics rules, they will apply as you multiply. So the answer will be the number of tablets to be given to the patient. Not if you are dealing with the meals, then multiply the volume of the container to get the number of meals required, which will contain the required dosage. For tablets whose answers have decimals, for tablets, you have to give whole tablets. That is half tablets, 0.5, or possibly quarter tablets like that. So for those tablets that have got provision for dividing, you can divide so that you can come up with the right milligrams. Okay, but otherwise, those that may give you the points, it might mean you have to give the whole tablet or you have to give to the smallest dose, and like giving the upper dose. So for liquid or round off the answer to one decimal place. This will apply to oral medication or injection unless using a tuberculin syringe. Then the answer should be rounded off to two decimals. For calculation of decimal dosages by weight of the patient, you need to appreciate that the dosage of certain medication must be calculated very precisely according to the weight of the patient. The bigger the patient, the more medicine will be given to that patient, and therefore the information needs to be calculated to correct dosage. The exact weight of the patient and then the amount of medication to be given for every kg of body weight. Okay. Okay, so from the above information, you can make two equations and cross multiply. Make sure that the same measurements are used in both equations. The answer will be the amount of medication to be given to the patient according to the weight of the patient. Okay, so here we have other examples of medical calculation. If you have understood the lesson, you can easily apply this. And then you can also refer to the policies within your institution. If at all you'll be rounding off to the upper, if it is point, because others in pharmacology, even if it is 0.1, you might, let's say it's 9.1, you might require to give 10. Okay, provided it's point. So you can ask for policy. Do you go to the smallest or you go to the upper? So it might not be to say if it is 0.5, you have to go to the upper. If it is 0.4, you have to go to the lower. So you can ask the hospital policy about those decimals, how to deal with them. Okay, so you can work out that example. So drugs that are commonly used on the ward are therapeutic, and a large number of these are antibiotics, analgesia, vitamins, and many others. You are therefore required to order essential drug from the pharmacy and stock all essential drug in the ward for the smooth running of your ward and reduce on drug or wastage. The pharmacist is responsible for the dispensing and supplying the drugs to the wards. Okay, he formulates the rules and regulations on the drugs, how they should be ordered and when. As a wardness, you are required to order antibiotic drugs per drug chart. Okay, this means that supply of drug is specifically for the admitted patient and the drugs should not be shared with other patients. This avoids overstocking of drugs by a particular ward, thereby avoiding creating an artificial shortage of drugs from the main pharmacy. However, other drugs for ward stock are ordered using a requisition book. If you use a requisition book, it should be filled in a triplicate so that the original copy is retained to the pharmacy for accountability sake. The second copy should be filled in the Word file, and the third remains in the book. The information needed include the name of the word, date, name of the drug, dosage, number of the tablets, okay, that were ordered. The word stock should also be indicated. Is the stock available equals to or new and the likes. Okay, so on supply chain, I think that lesson on the how drugs can be supplied, that one. I think I've tackled it. You can also look at the channel. You can also look at that topic which I've covered on that. Okay, where you can stock for 3 months certain drugs that you need to stock for 1 month and the like. You need to know how you supply, but those the patients you need to know that they have to be ordered like that. Of course, all this depends on the hospital policy on which drugs you can order away from the treatment chart. The person who orders then will sign and write his or her full names. When collecting the drugs and other supplies from the pharmacy, you can check carefully if all the ordered items have been supplied. You can then sign the requisition book for the items that have been supplied and store them in a lockable cupboard. You must be able to determine the appropriate routes of administration of drugs for the effects of the drug to reach the intended site of action. There are some drugs which, when you give via a wrong route, their effect cannot be achieved, and they cannot even help the patient or can even cause the patient to die. Okay, therefore, you must be aware of the 6 rights of drug administration and nursing implication of each method. You have also to know your responsibility after administration of drugs. Okay, so route of administration of the drug administration. When you want to administer a drug to a patient, you assume the responsibility for that procedure. Responsibility entails preparing and administering the prescribed drug. You are therefore supposed to observe the 6 rights in the administration of drugs. So you must ensure that it is, so these are the 6 rights of drug administration. You must ensure that it is the right patient, the right drug, the right dose, the right route, the right time, the right documentation. Okay, it should be the right patient. You take the treatment chart, confirm the name, ask the patient. The right drug, you check the drug that you are taking, and that you are giving the patient. But yes, the right dose, you calculate the dosage because what you might have in stock might not be what has been prescribed. So you have to calculate. The route, is it oral? Okay, is it intravenous? Is it intramuscular? The time, how frequent is the drug supposed to be taken, and are you giving at the right time? The right documentation, okay, the signing of the drug, okay, the right documentation, the date, and everything. So that constitutes that. So consideration in drug administration also may include drug errors are identified as any occurrence that can cause a patient to receive the wrong dose, the wrong drug, a drug by the wrong route, or a drug given at the incorrect time. Errors may occur in transcribing drug orders when the drug is dispensed or in administration of the drug. Nurses serve as the last defense against detecting drug errors. So when a drug error occurs, you report immediately so that any necessary steps are to counteract the action of the drug, or any observation can be made as soon as possible. Okay, so we have benzyl penicillin. Okay, the bottle or vial just looks almost the same as like the benzyl penicillin. It may look the same with procaine penicillin. Okay, and no, there are drugs that can be administered intravenously and those that cannot be. Okay, administered. Benzathine penicillin looks almost the same as benzyl penicillin. So if you administer benzathine penicillin intravenous, the patient may die almost immediately. Okay, so you have to read the name. Read the name. So 6 right has not been followed, then you see that you may make an error. So each time you prepare and administer a drug, the 6 right must be part of the procedure all the time so that you avoid drug errors. In addition to consistently practicing the 6 right, you should adhere to the following precautions to help prevent drug errors. Okay, so 1, you must confirm any questionable orders. Then, when calculating, okay, when calculations are necessary, verify them with another nurse. You must listen to the patient when he or she questions the drug, the dosage, or the drug regimen. Never administer the drug until the patient's questions have been adequately researched. Then, number 4, concentrate on only one task at a time to avoid errors that can be during administration of the drug. Errors most commonly occur because of the failure to administer a drug that has been ordered, administration of the wrong dose or strength of the drug, or administration of the wrong drug. Then number 5, you must have factual knowledge of each drug given. Okay, the reason for use of the drug, the drug's general action and the common adverse reaction associated with the drug, special precautions in administration, if any, and the normal dose ranges. Then number 6, it is also important for you to take a patient considerations such as RAG, okay, previous adverse reaction, patient's comments, and change in patient's condition into account. Therefore, then afterwards, as you administer the drug. Then the 7th, if the patient makes any statement about the drug or if there is any change in the patient, these situations are carefully considered before you give the drug. Examples of situations that require consideration before you give the drug include problems associated with the drug, such as nausea, dizziness, ringing in the ears, and difficulties in walking. And then others may include any comment made by the patient that may indicate the occurrence of an adverse reaction. Then the 8th risk consideration is that you must withhold the drug until references are consulted and the primary caregiver is contacted. The decision to withhold the drug must have a sound rationale and must be based on knowledge of pharmacology. Then the 9th consideration is a comment stating that the drug looks different from the one previously received, that the drug was just given by another nurse and the likes, should be taken into consideration, and if possible, the drug discontinued. Then the other 10 consideration, the 10th one is a change in the patient's condition, a change in one or more vital signs or the appearance of new symptoms may necessitate the change of the drug, depending on the drug being administered and the patient's diagnosis. These changes may indicate that the drug should be withheld and the primary care provider contacted. The oral route is the most frequent route or route of drug administration and rarely causes physical discomfort in patients. Oral drug forms include tablets, capsules, and liquids. Some capsules and tablets contain sustained release drug which dissolve over an extended period over time. Okay, so then on administration of drugs by oral route, we say administration of oral drug is relatively easy for patients who are alert and can swallow. Okay, so those are some of the advantages or conduciveness of giving oral drugs. So when ingested, the drugs come in contact with the mucous membranes lining the digestive tract, either in the stomach or intestine. Some drugs are coated so they will only dissolve in the stomach or the intestine. So other administration of drugs are by oral advantages, okay, is that some act directly on the membrane of the stomach or intestine, whilst others are absorbed into the bloodstream and have a systemic effect. They come in powder, tablets, pill, or capsule form, as well as liquid form. Some drugs are designed for immediate action, some are delayed action, and some for prolonged action over a period of time. Okay, so a patient getting oral drugs from a container. So that is just the illustration, pictorial illustration there. Okay, so nursing responsibility when you're giving oral drugs, you must observe the following points when giving these oral drugs. Place the patient in an upright position. It is difficult and dangerous to swallow a solid or liquid when lying down. Make sure that you have a glass full of water readily available for the patient. You can assess the patient's need for assistance and by removing the tablets or capsule from the container, holding the container, a patient's cup, or holding a glass of water. Some patients with physical disability cannot handle or hold these objects and may require resistance. Remember, direct hands should not come in contact with the drug because of maybe reaction, the lotion you applied in your hands. You can advise the patient to take a few sips of water before placing the tablets or capsule in the mouth. Certain drugs are also given by the sublingual, that is placed under the tongue route. These drugs must not be swallowed or chewed and must be dissolved completely before the patient eats or drinks those that are administered under the tongue. So nitroglycerin is commonly given as sublingual. Parenteral drug administration. Okay, so now on administration of drug, parenteral drug administration of drugs by the parenteral route. Okay, so when administering drugs by parenteral routes, these are other routes for parenteral administration that may be used by the doctor, but includes intraregional, that is into a lesion, intra-arterial, into the artery, intracardiac, that is into the heart, and intra-articular into a joint, and intrathecal route. So this is where a drug is introduced in the subarachnoid space for local action in the central nervous system, as in spinal anesthesia. Okay, so what are some of the nursing responsibility when a parenteral drug has been given? You must observe the following points when giving a drug by the parenteral route. That is, you have to wear gloves for protection from the potential of a blood spill when giving parenteral drugs. The risk of exposure to infected blood is increasing for all health care workers. So the Center for Disease Control and Prevention, CDC, recommends that you must wear gloves when touching blood or body fluids, mucous membrane, or any broken skin area. This recommendation is referred to as a standard precaution, which combine the universal precaution for blood and body fluids with body substance isolation guideline. Okay, this is to avoid infection. So after selecting the site for injection, you can cleanse the skin. Then most hospitals have a policy regarding the type of skin antiseptic that is used for cleansing the skin before parenteral drug administration. But mostly alcohol-based antiseptic are used, like methylated spirit. Okay, so you can cleanse the skin with a circular motion, that is starting at the inner point and moving outwards. So you make the inner part sterile and then you move the dirty outwards. That, of course, that is why we are doing this circular motion, so that it is cleaner at the center and the dirty moves outwards. Okay, so after inserting the needle for IM administration, you can pull back the syringe. Okay, when you pull back the syringe barrel, this is to try to aspirate the drug. So if blood appears in the syringe, you can move the needle so that the drug is not injected in the vein, okay, or in the artery. Then you can discard the drug and needle and syringe and prepare another injection. If no blood appears in the syringe, you can inject the drug. Then that's a sign that you are in the muscle. Okay, aspiration is not necessary when giving an intradermal or subcutaneous injection. After inserting a needle into a vein for intravenous drug administration, you can pull back the syringe barrel. Blood should flow back into the syringe. So after backflow of blood is obtained, it is safe to inject because you are now directly in the vessel. After removing the needle from an eye intramuscular and subcutaneous or intravenous injection site, you can place pressure on the area. Patients with breathing tendencies often require prolonged pressure on the area. Do not recap syringes and dispose them according to the institutional policy. Okay, you can discard needles and syringe into clearly marked appropriate containers. Okay, so most institutions have a sharp container located in each room for immediate disposal of needles and syringes after use. So you have to observe the color codes for disposal of these needles or these bioproducts that have come in contact with the patient. Okay, so image here is showing a patient receiving an intramuscular injection. Okay, so you kindly take note that 90 degrees you are giving an IM. Okay, at 45 degrees also you are giving a subcutaneous injection. So those are some of the things. Then a subcutaneous injection presses the drug into the tissue between the skin and the muscle. Drugs administered in this manner are absorbed more slowly than are intramuscular injection. Heparin and insulin are two drugs most commonly given by the subcut route. Okay, then nursing responsibility for subcutaneous route. You must observe the following points when giving a drug by the subcutaneous route. That is, a volume of 0.5 to 1 ml is used for subcut injection. Larger volumes, okay, of like let's say more than 1 ml are best given as the intramuscular. If a volume rather than 1 ml is ordered through the subcut route, the injection is given in two sites with separate needles and syringes. The sites for subcut injection are the upper arms, the upper abdomen, and the upper back. Rotate injection sites to secure proper absorption and to minimize tissue damage. When giving a drug by the subcut route, insert the needle at 45 degrees angle. However, to place the drug in the subcut tissue, you can select the needle length and angle of insertion based on the patient's body weight or amount of fat on the skin. So obese patients have excess subcutaneous tissue and it may be necessary to give the injection at 90 degrees angle. If the patient is thin or cachexic, then usually they have less subcutaneous tissue. For such patients, the upper abdomen is the best site for injection. Generally, a syringe with a 23 to 25 gauge needle that is half or to 8 inches in length is most suitable for the subcut or subcutaneous injection. Okay, so now let us now talk about the intramuscular route of drug administration. Intramuscular route or route of drug administration. An intramuscular injection is the administration of a drug into a muscle. Drugs that are irritating to subcutaneous tissue can be given via intramuscular injection. Drugs given by this route are absorbed more rapidly than drugs given by the subcutaneous route because of the rich blood supply in the muscle. In addition, a larger volume of 1 to 3 ml can be given at one site. Okay, that gives it an advantage as compared to the subcut where you can give a volume of 0.5 to 1 ml. Anything more than, then you have to give two sites. But for high intramuscular, you can give 1 to 3 ml, that is on one side. Okay, so now let us look at the nursing responsibility. Okay, as you give intramuscular injection, the nurse should observe the following points when giving a drug by the intramuscular route. If an injection is more than 3 ml, divide the drug and give it as two separate injections. This is very important to avoid cord abscess, where there is a lump that forms in the muscle. Okay, so this lump may be, this is what we call a cord abscess and may be there for a long time. Volumes rather than 3 ml will not be absorbed properly, or there might be difficulties in absorbing a larger dose of 3 ml. A 22 gauge needle that is 11 over 2 inches in length is most often used for intramuscular injection. So please, here I urge you to kindly note that in 3 or 4 ml drug, 4 ml can be given anything more than 3 or 4 ml. It's not advisable to give intramuscular injection, that is to give, let's say, 5 ml, 8 ml, okay, on one side. It may create a cord abscess. So this is very, very important in practice. Okay, so the sites for intramuscular administration are the deltoid muscle, okay, that is the upper arm, the ventrogluteal or dorsogluteal sites, that is the hip and the thigh or the site is frequently used, the thigh can be frequently used for infants and small children because of it is more developed than the gluteal or deltoid sites. In children who have been ambulating for more than 2 years, you can use ventrogluteal sites. Okay, so children more than 2 years, you can use the gluteal muscle. Less than 2 years, the site is not well developed. So mostly we use the thigh. That's why even for the vaccines, you find that they use the thigh. So when giving a drug by the intramuscular route, insert the needle at a 90 degrees angle. When injecting a drug into the ventrogluteal or dorsogluteal muscle, it is a good idea to place the patient in a comfortable position, preferably in a prone position with the toes pointing inwards. When injecting the drug into the deltoid, a sitting or lying down position may be used. A drug administered by intravenous route, or let us now look at the intravenous route drug administration. So a drug administered by the intravenous route is given directly into the blood by a needle inserted into a vein. So drug action occurs almost immediately. You must always ensure that drugs administered via the intravenous route are given slowly over 1 or more minutes. Okay, it's not advisable to give fast, but it's advisable to give slowly. Okay, so I can only give intravenous drugs rapidly by, let's say, piggy bag infusion. That is drugs that are used with 50 to 100 ml of compatible IV fluids and administered during a period of 30 to 60 minutes. Okay, piggybacked onto the primary intravenous line. So an existing intravenous line, the IV ports, into an intermittent venous access device called heparin lock. That is a small intravenous catheter in the patient's vein connected to a small fluid reservoir with a rubber cap through which the needle is inserted to administer the drug. Okay, so now reasons for giving drugs parenterally. Let us now look at the main reasons as to why drugs can be given parenterally. So one of the reasons is to assure rapid action. Drugs that are given parenterally, they are easily absorbed and are used within the sites. So that is to assure rapid action. To prevent the drug from being destroyed by gastric juices. Some drugs, okay, if taken orally, they can be destroyed by gastric juices. So that's why they have to be given parenterally. To give a drug when the patient is unable to take it orally, for instance, the unconscious patient. So in unconscious patient, it's advisable you give drugs parenterally. Or if a patient is vomiting or is mentally disturbed, they may not swallow the drug. Okay, the other reasons as to why we give drugs parenterally is to prevent irritation of the mucous membrane lining of the gastrointestinal tract. And then the other reason, some drugs are not absorbed well by the digestive tract. Okay, so now let us look at nursing responsibility after drug administration. So this is just in general after drug administration. After you have administered of any type of drug, you are responsible for the following as a nurse practitioner. The documentation of the administered drug, you must complete this task as soon as possible. This is particularly important whenever necessary drugs, especially narcotics, are given to prevent repeated giving of drugs. So documentation, signing for the drug is very, very important. Okay, then this is when we talk about topical application of a drug. Topical application, this is the process of administering a drug to treat infections affecting the skin by directly applying the drug on the affected site. So we say this drug is applied topically, meaning it's applied on the skin or mucous membrane, so topical. So this is the process of administering a drug to treat infection affecting the skin by directly applying the drug on that affected site. Topical drugs administered through the following ways include the spraying or painting on the skin may be done for direct action at the point of contact. Then water solutions, lotions, alcoholic solutions, or tinctures may also be used as topical application. Okay, so then others, rubbing, okay, the other things that can be used done is by rubbing onto the skin, or it can be used for local action or systemic effect. Okay, so for local action, you can use a topical drugs. Okay, you can use topical drugs for that local action on that area. So, like let's say in anesthesia, okay, you can have a topical spray that you can use. Of course, they are also injectable, local anesthesia, but there are also those sprays that can be used. Okay, so now other topical application drugs include ointments, oily preparation which you can rub in or apply to the skin for local action or on skin region of various kinds. So ointments, these can be pregnanted with a certain drug that is active within this ointment. Then creams and water-soluble substances which you can rub in or apply to the skin for local action on skin region of various kinds. Okay, so liniments are rubbed in and applied to the skin. They have the property of a counter irritant or heat production. So they have the property of a counter irritant or helping in heat producing. Plasters and poultices containing medicine plus other ingredients which are usually warmed and wrapped in material or heavy paper and applied to the patient. They can have a local action or the substances are absorbed and affect other areas of the body. Complex, okay, so then these topical application drugs, we can use compressed moisture dressing and soak them. Usually, you can have a local effect when you moisten a dressing through some water, and you are supposed to hold that substance that affects the general health of the patient. So you apply it there, and you apply a compress directly on that. Okay, so now looking at drugs acting on the skin, there are several creams or ointments that can be used to treat a skin infection. Below are some drugs which are applied topically. Bacterial infection of the skin can be treated with topical antibacterial to combat infection. Okay, so some of the antibacterial preparations that are used topically or that are used on the skin include neomycin plus bastricin ointment. So the indication is skin infection administration. You can apply 3 times a day. The side effects may include a local hypersensitivity reaction. The caution that you need to take when giving drug like this is contraindicated in large open wounds. So you have neomycin plus bastracin ointment. Okay, so in an ointment, you put neomycin and bastracin. Okay, you pregnant those in an ointment, and then you can apply on the skin directly. Antibacterial preparations, okay, so under antibacterial preparations that come and can be used topically, can be used on the eyes, can be used, include tetracycline. So presentation, it may come as an ointment with 3% of the drug, okay, in the ointment. Indication, impetigo, infected burns and abrasions. You can apply 1 to 2 times daily. The nursing responsibility when you apply this tetracycline is that you must observe if the patient has reacted to the topical drugs applied by looking out for rash, blisters, and if the patient is complaining of itching sensation. Okay, patients applying drugs topically. So here it's just an illustration of someone who's trying to apply a drug topically. Of course, this is after here the gentleman he is after pain. Okay, so he's applying a topical drug. Okay, so Now let us talk about antibacterial preparations here for instauration. Okay, so other drugs are administered by instauration. So these include drugs used to treat eye, ear, and nose infection, or drugs that are used in what we call ENT, which is a specialty. So these include drugs that are used for ear in ophthalmology, okay, those that are used for ear infection, and those that may be used for nose infection. Okay, so here we have a patient instilling ear drops. Okay, here is a patient who's instilling some ear drops, and then patient instilling eye drops. Okay, so they're instilling those. Of course, these are pregnated with drugs in them. Okay, so what are some of the nursing responsibility when you give these installation drugs? You must ensure that the nozzle of the applicator does not touch the patient's eye. Okay, as now the drug now is going to have the close infection, the infection from the eye. So you must ensure that the nozzle of the applicator does not touch the patient's eye, ear, or nose when instilling the drug. If one drug is used on many patients to prevent contamination. Of course, even when it is used on one person, one eye can be infected, but you also need to also treat the other eye. So you may start crossing infection from one eye to the other. You may start crossing infection from one ear to the other, or one nostril to the other. But you have to kindly note that this practice should not be used is for the issue of preventing of cross infection. Therefore, you should request a patient to buy if the drugs are not available, because we do not necessarily use one drug that is meant for installation on different patients, because the patient need to have a personal drug that they have to use. So below are some of the examples of drugs administered by installation. Okay, we have mediatrix, e.g., for instance, atropine. So, mediatrix, that is, directs at the pupil and paralyzes the ciliary muscle. So, mediatrix, okay, their work, for example, atropine, here they direct the pupil, okay, and it paralyzes the ciliary muscle. So, when talking of ophthalmology drugs, okay, so when just talk of mediatrix, so the D part there reminds me that we are talking about drugs that direct the pupil and paralyzes the ciliary muscle. Presentation may come as 1% eye drops or ointments, and indication is for inflammatory condition of the eye and when examining the eye. Okay, so in examining the eye, you want more light to enter into the eye. So you want to, if patient has iritis, iridocyclitis, keratitis, cornea ulcers, and may have sclerokeratitis, may need to dilate the pupil. Okay, then preventing also of adhesions or pre-op for cataract, you may need to use mediatrix. Okay, side effects: raised intraocular pressure and transient stinging. Okay, stinging, hyperemia, local irritation, and the edema may occur after prolonged use. Okay, so most of the drugs that we put within the eye, because they are foreign, they cause some stinging sensation, okay, irritation, they may cause all that. So when you give this drug, there is increased intraocular pressure and the local irritation. The contraindication, okay, of this drug is that give with caution in very young and very old clients, as it causes toxic systemic reaction. Nursing responsibility is that you must advise the client if they drive to rest for 1 to 2 hours after installation of the drug. This is to prevent accidents, as more light is entering in the eye and that will disturb perception. Okay, so now let us talk about drugs that are given by inhalation. So this is the administration of drugs through respiratory system by breathing. Drugs administered through this route include sprays or nebule. Okay, so you have nebule containing fine particles of drug suspended or dissolved in oil or water. Okay, these are then inhaled. They are used for the nose, throat, and the lungs. They may be a local or they may bring about local or systemic effects. So here is a patient who is using an inhaler. Okay, so find that a smart patient using inhaler. So your patient there using inhaler. Okay, then we have aerosols. These are suspension of fine solid or liquid particles in air or gas. These may be drawn into the lungs or forced in or in on a flow of gas such as oxygen from a tank. So here we have an illustration, someone receiving oxygen. Okay, so then steam can be used to carry drugs into the lungs. The water vapor itself may be the important substance or it may carry the needed drugs. Okay, so here we have an example of a patient who is doing some steaming. Okay, medicine could also be burned and the smoke inhaled. Okay, we have such instances. But what are the responsibility for inhalation of drugs? You must ensure that the patient is closely observed to detect early if the condition is improving or not. Okay, then now let us talk about rectal drug administration. Certain drugs can be given by suppository or less commonly by enema. Drugs uh, that may be irrigative when given orally. Uh, so drugs that may be irritating when given orally are better tolerated when given by this route, that is the rectal route, and nausea does not prevent giving the drug. So each drug with whatever route has been used may bring about some side effects. But if at all it cannot be tolerated orally, we have certain drugs that have been manufactured just to be administered through the rectal route. The nursing responsibility when giving drugs by the rectal route is that you must request the patient to be in a prone position to enable him or her retain the drug for 20 to 30 minutes for the effect to be elicited. Okay, so now administration of intravenous fluid to clients. There are several reasons why a patient might need to have fluid administered intravenously. Okay, so here we're looking at administration of these intravenous fluid, the normal saline, the 5% dextrose, 10% dextrose, and the likes. So there are several reasons why a patient might need to have fluid administered intravenously. This typically involves opening a vein, okay, with a cannula and injecting fluid through a vein, usually on the arm. During your clinical placement on the wards, you will be required or may be required to cannulate patients who need fluids. Okay, kindly, you have to, when doing administration of intravenous fluid to clients here, you need to also note that you may need to take the opportunity to sharpen your skills in cannulation, okay, so that you do not end up pricking the patient unnecessarily. It is encouraged that you start from below and then go up as you start from the lower arm part and then you can go up to cannulate. Okay, so fluid used are water with either salt, sugar, or medication added in concentration that depend on the individual. Okay, so IV treatments may include rehydration after being dehydrated from illness or excessive activity. So here we're looking at the reasons for giving IV fluid. So what are some of the reasons why we give IV fluid? So we give IV fluid in order to rehydrate the patient, and then we also give IV fluid for chemotherapy drugs. Let's say in cancer drugs treatment, we may put the drug in a fluid. Okay, so we may we may give IV fluid for simple reason like in chemotherapy treatment, antibiotics to treat an infection. So you may administer some drugs. Okay, that is IV fluid. Like we have available ciprobid and we have metronidazole as an IV infusion or as an IV fluid, okay, with the drug in it. So it can be administered like that. Then medication for the treatment of pain. Okay, we have drugs that can be administered within that way. And when you talk of aminophylline in management of asthma, you find that you may need to put in a fluid. Okay, so the rate and quantity of intravenous fluid may depend on medical condition, body size, and age. Regulation ensures the correct amount of fluid drips from the bag down the tube into the vein at the correct rate. We have already done the calculation for administration of IV fluid. You can always refer to that. Complications can result from receiving too much, too quickly, or not enough, too slowly. Okay, so intravenous fluid regulation, there are two ways to regulate the amount and the rate of fluid given during intravenous therapy. Okay, so there is manual regulation. So the rate of fluid dripping from a bag into an IV can be regulated through a manual technique. You can increase or decrease the pressure that a clamp puts on the IV tube to either slow or speed the rate of flow. You must count the number of drops per minute to make sure the rate of flow is correct and adjust as needed. Okay, now on the issue of the pump, the rate is modulated with an electric key pump. In this case, you program the pump to deliver the desired amount of fluid into the intravenous line at the correct rate. Whether done manually or with a pump, okay, so IV intravenous fluids must be checked regularly to ensure or to be sure that the patient is getting the correct amount of fluid. Okay, then controlled drugs. Okay, the administration of controlled drugs. We want to look at the drugs here that are regulated. Okay, remember we have looked at some controlled drugs in one of our lessons here in our series of looking at pharmacology. So now we're looking at administration of controlled drugs. So controlled drugs are drugs which are liable to misuse and are controlled by the Controlled Drug Act. So these drugs can only be administered upon being prescribed by a registered medical doctor. They are controlled because they are active. Okay, so some of the rules of administration and storage of controlled drugs may include the following. One, should be prescribed by an authorized clinician. Two, they must be kept in the hospital in a double locked cupboard. Number three, the key to the double locked cupboard must be kept by a registered nurse. Then number four, a register must be kept with a separate section for each drug. Like if you have 50 milligrams separate, 100 milligrams separate. The types of drugs, they are also separate. So ink must be used and not necessarily pencil. The nurse giving the drug plus a registered nurse, okay, must sign out the drug from the controlled drug cupboard. So the nursing responsibility when administering controlled drugs may include that any drug which is wasted must also be recorded, marked wasted, and signed for. The controlled drug register must be kept for 2 years following the last entry. So it should not just be discarded, it just be kept at least for 2 years after the last entry. Okay, so you kindly note that the register is locked up together with the drug in the cupboard. Once the new stock is acquired, it must be entered in the register and balance must be recorded accurately. So now, in summary, in ordering and control of drugs here in this unit, I'm confident that you can order and kind of any kind of drugs, including controlled drugs. Okay, so there are procedures that you can still do related to pharmacology. On controlled drugs, you can look at the checklist and see whether you can now follow those steps for ordering of controlled drugs according to policy or according to the procedure. So administration of controlled drugs, you further learned on the route of drug administration and the importance of choosing the right route before administering any drugs. So this is necessarily what we have been looking at, and I hope you have reflected and you have learned a lot on ordering and control of drugs. So please I urge you as you listen to these lessons, you can always be taking some brief notes. It will necessarily help you. There are main points here that you have put, but this is a holistic key lecture.